say hospitals are willing to provide proper training for healthcare workers who may be encountering patients with Ebola.
And we have seen in our hospitals in this country that they have not given us this information. And then, when the nurses become infected, they are blamed for not following the protocols. That is not going to work.
The CDC says training at the Texas hospital where the healthcare worker was infected has been ramped up.
This is a video to show the proper way to remove your personal protective equipment. First, you would, before you leave the patient's room, you would clean the soiled areas of your suit with bleach wipes, wiping it off with bleach wipes. Dispose of the wipes, foot covers, and patient gloves in a bag. A biohazardous bag. On exiting the patient's room, step directly onto a large biohazardous bag that has been placed in a plastic tub to hold the sides up for stability. Your partner will fully remove the tape of the cuffs. During the process, you should keep your arms low over the biohazard bag, so any drippage would fall in the bag. The PAP, battery, tubing, and belt are non-disposable items. Keep the PAP switched on and undo the PAP belt. Place the PAP unit on a stable surface. Your partner will next wipe the PAP tube, battery pack, and belt with bleach wipes. During the procedure, you will not let the tube touch your suit. Pull the outer layer of the hood up. Your partner may now unzip the suit. And it's zipped around the neck, too. I always want you to put it on. It's a procedure. See, well, they didn't show him unzipping it, but now allow the neck of the suit to roll outward away from the body. This is where they had the problem, I think, because they don't have anybody to help them take it off. Begin removing the suit by rolling it down towards the biohazard bag. In this procedure, they're helped, making sure that none of the outside of the suit is coming into contact directly with their skin. When the suit is pulled away from the arms, the outer protection gloves will remain in place because they have two sets of gloves on, so they're keeping the last pair on to take their shoes off. Continue to remove the suit until the ankles are reached. Next, remove the outer extra protective gloves. Dispose of these in the biohazard bag. Roll the outer layer of the hood down so visibility is restored. Then step out of your suit and biohazard bag onto the floor. Your partner will now switch the PAP unit off. Disconnect the PAP tubing from the battery pack. You can now remove the hood by pulling the outer layer together overhead and using a forward, up, and over motion. Drop the hood. Be careful not to touch yourself with the hood, the PAP tubing, or the exam gloves. Your partner will carefully remove the PAP tubing and for cleaning and reuse. Next, remove the inner boot liners. These should be placed in the biohazard bag as well. See this getting very expensive if you do this every time, 2 or 3 times a day. I know I wouldn't want to wear that all day long. I guess they have to, though. Just keep the temperature in the room real cold so they don't overheat. Remove the exam gloves by using the glove-in-glove technique. See how they peel it inside outwards so that they're never touching the inside of the outside of the glove. Your partner will seal and dispose of the bag and attend to the reusable item. Next, you're going to wash your hands with the hand sanitizer available outside the patient's room. Then proceed to the sink and wash your hands. Rehydrate. Then record the time you took your personal protection equipment off and your vital signs. On the checklist, and then proceed to the shower.